Welcome everyone to this webinar, which is organized by STARS Association. And for people who doesn't know, the STARS stands Swiss Team for Autism Resources and Solutions. And I'm your host, Irina Shurov, who is a nutritional neuroscientist. And we try to organize those webinars where very interesting people and professionals share their experience and talking about the very interesting techniques, which can be very helpful for our children with neurological issues, conditions, problems, and so on. And today I've got a pleasure to present to you a very special guest. So it's Dr. Laurie Gaudimier. She is a practicing neurofeedback in Geneva, but she is much more than just neurofeedback. She's got quite a few specialities, and so she's got degree in immunology. She's got PhD in biomedical sciences. So she's now also a professional in osteopathy and craniosacral therapies. That's correct?
That's correct.
Yeah, and she's also a book writer as well, so which is fascinating, I think. So, Laurie, it's great to have you here. And can you just a little bit start to talk to us? What is a neurofeedback, and how we can implement this technique to our children who are struggling to focus, to concentrate, who would like to improve the performance academically and just feel better in life and in terms of stress management and etc. So over to you.
Thanks a lot, Irina. Thanks for this great introduction, for having me with you in those very interesting talks. So I'm practicing with neurofeedback, which is a way to read the brainwave with an EEG machine, like the same one you would find in an hospital. So we would be able to make not a diagnostic, because it's not considered as a diagnostic, but an evaluation of the brainwave and the functioning of the brain for children as for adults. I'm working with both populations, and based on what we evaluating on those first session, we would have an idea on which area of the brain need to be trained. So the way this is working, on the first session, we would do a scan, which is the same for everyone. We're going to measure the prefrontal part of the brain, the mid-prefrontal brain, which is related to the way the individual is integrating emotions. Then we will have also reading of the cognitive processes and attention processes through the sensory motor cortex. We also would have an idea of the functioning of the occipital cortex, the back part of the brain, which would give us an idea of the visualization processes, the regeneration processes, and this has to do a lot with the alpha brain waves. Probably you heard about that. And say if we have a children with attention deficit, most symptoms will be seen in the frontal brain, the prefrontal brain, which will be slower than a typical children or someone with no attention deficit.
Mm-hmm.
And basically, when we have this scan, we will train the child on those brainwaves. So basically what can happen in the sessions, the following session, is that the child is going to watch a DVD, a movie, a cartoon, whatever he likes. And this movie will be bound to the readings of the brains. And every time it's working slower than what it should be, which explain partially is attention deficit, the movie is going to stop. So that is as simple as that. It's kind of, we call this operant conditioning. So the brain obviously doesn't like that the movie stops, so it's going to try everything to increase the signal and have the movie plays non-stop, and by doing so, it will increase the activity of the prefrontal cortex. So of course, this is building on sessions, so we need a couple number of regular sessions so that those automatisms are built in the prefrontal cortex of the child. But most often we can see a correlation of those brain waves rising up and changes in the behavior of the children, no matter if it's related to emotional processes or to attentional processes.
Mm-hmm.
And once again, this is working greatly for children with attention deficit. There are strong evidences and scientific validation. Actually, it's even... So how does neurotraining works? Basically, as you can see on this image here, we would have, let's say here we look at the first on the list, which is brain activity, so EEG. So we would have a signal which is recorded by this very small machine that is going to be bound to the computer, and it will be linked to a movie. Let's say if we set up a threshold, once again in the context of this attention deficit, the brain is working at 6 to 8 hertz, while it should be like higher up, like 12 to 15 hertz. So we will set a threshold of 12 hertz. Mm-hmm. And the movie, every time the signal is going to be lower than 12 hertz, the movie is going to stop. Mm-hmm. And this is how you get your direct feedback, and you can act, I mean, not consciously, it's mostly unconscious, especially for the brain activity, but this is how this is working. Mm-hmm. And as you can see in the list, we can work exactly the same way on different parameters. The other one, they're known under the umbrella of biofeedback. So this is everything that has to do with the physiological stress. For instance, the first one is muscle tension. So a lot of people, when they are stressed, they start to increase their muscle tension. But if they have a direct feedback and they see that their muscle tension is going up, they're going to be able to act on that and to decrease that. So that's going to be the same principle also with the HRV, which is the heart rate variability, also known as cardiac coherence, and the breathing parameters. I mean, we know that we're breathing, but then it helps to see the way we're breathing on a screen to be able to act on that. And it works very great with children as well, because it's quite easy to play with the breath, and then they quickly...
It's visual as well, yes? So
exactly, you have visual.
nice to have that picture of what's going on inside, yeah.
You can have very raw visual, like just waves bound to your breath, like you inhale, this is rising up, you exhale, this is going down. But with children, you can also have like flowers opening with the inhale and then closing with the exhale, a lot of different things. You can have puzzles, you can have space rocket moving through the air. So this is a way that the child is not getting bored, it's getting interested in what he's doing, but he also has a direct feedback on how it can impact on his own physiology. Mm-hmm. We can measure all this with the same device, which is very portable, easy to take some different places. And so more about the EEG device. This is like very, very easy stuff. So it's just like those small sensor that we put on the head. So that's not a kid, but I work with kids as well. And through so you can see the presentation, right?
Yeah.
Okay.
You know, it's very good because it's easy had to demonstrate the device.
Yeah. So through those machines, you can see that there are different electrodes that you see here, and those electrodes are simply recording brain activity, and we can measure different area of the brain. So what you can see here is the most specific area that I measure in the first evaluation that I call neuroprofiling. So we measure the back of the brain, which is the occipital cortex, and will give us an idea of stress in someone, and also the regeneration processes, visualization as well. So this is giving us an idea of people making alpha brainwave. Probably you heard about alpha brainwave, which are related to regeneration, and so then we can measure...
Is it required awakened or sleeping as well?
Sorry?
The EEG determination, is it required awake person, or
I
you're
do
doing
that
both for sleeping?
No, I do that on a awake person, like someone who is seated, and it's just like, it's very short one. Like the longest part that I do is to take the exact measurement to find the exact area of the head. So I have a little cask that the person put on the head. It's easier with bald people, as you can see, at least for demonstration purposes. But no, you do that on an awake person, because the person has to be also to do some cognitive tasks. exactly for this bubble that I'm showing now, that we measure, so the cognitive area of the brain, which is the central cortex. So we measure perception and sensory motor features. And we also measure the prefrontal cortex, so which is related mostly to attention, concentration, and executive function, mostly related to organization skills and memory as well. And the very important one, especially for children, is actually not only for children, but is a part of the prefrontal cortex which is directly related with the limbic system. And it's called sorry, some of my slides are in French, but which is going to give us an idea of how the brain is integrating and processing emotions. So once again, this is the machine, very small device. I have a computer and then the screen that the person really has a direct information about what is measured. So that's one of the biggest idea of neurofeedback, is that you measure something, but you see it in real time. So you understand first how you function and how you can impact on this functioning. So I'm going to show you how I use that for children, yes?
Is the sensor and the software you are using is a kinds of customized one you manufacture by yourself, or it is something
it's from,
generic you are using?
No, it's from a company that is called Mind Media, is from the Netherlands. And I've been trained by a research and formation institute in Vevey, in Switzerland. So, and this is the really medical machine. I mean, that's the medical EEG, but then the machine is developed by this company, Mind Media. And they also make the games that I'm working with. So they provide all this device. But the big interest of this device that I'm using and I'm presenting today is that you can do both biofeedback, which is related to neurophysiology and breathing, heart rate variability, at the same time as you do neurofeedback, so working with the brain waves. So you can play on parameters and then adapt to more people, especially children.
Can I just say, can we keep questions to the end and just type them in chat? You have a chat at the bottom, so you can type your questions, then we can read them in order once we start Q&A. Otherwise, recording is not going to be very clean for people who are going to watch and listen afterwards. Okay.
Thank you.
Thank you.
So basically, when you do this quick evaluation, like it will be like about 20 minutes for the whole thing. So you measure those 4 areas that I'm showing you now. You get, so these are like another representation of what I'm measuring. So you get a report, like this very complicated report with numbers, and these are like aligned to normalized databases. And from this, what I've been developing is a kind of easier way to see the results, which would give us an idea of how the sensory motor cortex is working, how the occipital, so as you remember, is the one related to stress, and how the frontal, prefrontal cortex is working relative to especially the executive and emotional functions of the brain. And then the person receives, like children, like adults, they receive this kind of report where they see this spider graph, which is kind of easier to see. Like, for instance, here you would see a person with like low scores into the occipital green area. So someone with a lot of stress. So you can see the anxiety is quite low scores. And it's also someone, I hardly can see here, I need to move that. Oh yeah. So it's someone with very good attention and cognitive process, but then like stressing a lot during performances. So you can see those different parameters. And once you have this, this is giving us an idea, a quick idea of the strengths, weaknesses of someone, children like adults. And this is especially for me giving a basis for neurotraining. So meaning which area of the brain am I going to train during further sessions. And that would be now.
To focus, yes.
Sorry?
Where to focus, yeah.
Yeah, so that it really makes something specific, because there's some kind of neurofeedback where you work with the same program, so it's one size fits all. Here I'm really working on the specific person, like the specific needs of the person. And if we take now the example of attention deficit and autism, so our main challenges like would be here I mean, that's what I see mostly in the practice, would be mostly restriction of the sensory motor cortex. We would have like low scores with concentration and attention, Some children may present already with dyslexia and dyspraxia, or impulsivity and hyperactivity. So that would be a typical example of a children with strong attention deficit. So you can see here, like in the blue area, which is the sensory motor cortex, the scores are quite low in terms of attention, cognition, and so perceptions. But there's a good dealing of stress in this example here. And the idea of what we're doing in coalescence is that we have different solutions to address such patterns, such children, for instance, through neurotraining that I'm going to show you right now, like using video games, through work on the coordination and motricity, because I'm also a yoga teacher specialized for children. So I'm using some of the movements, some of like the combining with motricity. And also, as you said, I'm also working with mindfulness and relaxation, also specifics for children. And I'm using those tools, and together with you, Irina, I can be done some micronutrition solutions. So basically the idea is to really make something that fits the need of the children, like the exact need of these children, which would be completely different than another one. And for instance, let's say we have a children with a prefrontal issue, like we have here a sensory motor issue. We would place again the electrode for the training on the area that needs to be worked, and the children will look, for instance, here a video game, like it will have 3 different worms that gonna run depending on the activity that the brain does. So the children doesn't really have to think about what it's doing. It's called operant conditioning. So the brain receives like either a go or no go. So the worms are moving forward or not. And then the brain wants the worms to move forward. So it will try everything. And as soon as it will try, it will find what makes the worms move forward. It will redo those patterns. So it will train the new patterns. It will retrain naturally his function. So that's a typical video games I'm using with children, but we can use also movies or music, different feedback. So the idea is that it really has a direct feedback that informs how the brain is working on this moment. And here there will be different device that I'm using. Here you can see the example of a little girl working with this headband, which is measuring indirect the cerebral blood flow. So if you want to use the prefrontal cortex, you have to bring more blood to the brain. So here as well, you will see the direct response. So the brain is going to try anything so that the movie plays continually. And at some point, it will understand what it has to do, and it will increase the blood flow naturally to the brain.
And children, can I just quickly ask, and children actually can see that change is happening in their brain as well, yes? So they don't just see the play screen, but also they see...
Yes, as you can see on the graph with the worms, you can see that there's the bar. So I explain them like what the bar are, and usually they ask for it. There are scores as well. You can see here there's points. So like they really wanted to make the points move. And here there's another example of my son being trained with both the headband, and you see the belt and something on the finger, which is making him also train the heart rate variability and the breath at the same time. So really combining all aspects. And here would be another example with the children with a issue of motricity, and then we use like those Swiss balls that they can sit on, so then it's kind of also challenging the balance at the same time.
Okay.
So that's the way I'm working for attention deficit and autism in the office. That is quickly an image of progress tracking, because I show you those graphs with colors, and this will be, so it's not only children, as you can see here, from the age of the people, but this is just to show you the progresses that we can have in couple sessions. So here, like it's between 10 and 30 sessions. So this is the first one, is someone who increased his creativity actually. So you can see that the blue is filling up. So someone who is making way more alpha brainwave and became way more creative after that. This is a children who was presenting some kind of anxiety and emotional issues as well. And you can see like the orange bar is getting filled with the green bar. And this is an athlete I was working with who was kind of performing on the cognitive aspect. Actually, that's an athlete, but he has also attention deficit, so he's an adult with attention deficit. And we got also important progresses with this person. So this is just a last slide to show you, as I was saying, that we can also work with the breath. This is the biofeedback part, so the neurophysiology. And I usually combine both. And so the children would have the belt, and he would kind of draw the breathing using his breath. He would draw the breath using the belt here. And this is the different scientific validated application of neurotraining, like for performances and creativity, for attention deficit, as well as cognitive performances. I work with a lot of people showing anxiety and burnout, chronic pain as well. And this is, as you mentioned, I'm training now as an osteopath and craniosacral therapy. So that's an excellent combination of both approaches. And people with insomnia, we have great results as well. And I work also with re-education and trauma. Mm-hmm. So that's basically the image you see on the top is, sorry, it's in French, but then that's a big picture of what we're doing. So we have a specific and individualized training, and the person receive, like in real time, a report of how his brain is working, and then he can act on it, and then at the same time receive a multimedia feedback that kind of makes it more interesting than just like seeing lines or graphs or so here we are. Try to make it short, so then I spend more time on your question. Maybe I can leave this slide on while we're talking, or we can remove the screen. It's up to you.
Okay, great. So I think it's very nice observation. What is clear? So we don't have any questions typed. Okay, so we just open panel for questions now. So if you know, I can just summarize. So this method is very can have a very broad application. Mm-hmm. What is the beauty of that? So you dealing not just with the brain as an isolated organ, it's also the part of the body, and you actually train the brain to respect and behave accordingly the whole physiology in the body. Mm-hmm. And you also identify the area where to focus based on very sort of individual needs. Exactly. And what is, I think, very good, and when you tried that method on me, I found it's very fascinating, very stressed, by the way. So what you can see how that measurement's changing. Yeah. You can really identify your potential, your strengths, and how far you can go. This gives you lots of power to control.
Yes. And on this point, what is very interesting also is for some children which are kind of at the border of having this attention deficit, but no name or no diagnosis put on that. It's important for them to see so that it's not that they're not making efforts, it's that the brain is also having a kind of natural switch toward making more slow brain waves. So they also they also understand that there's a kind of dysfunctioning of the brain. It's not them not making efforts, is also the brain that is kind of just not regulated the proper way. Yeah. And very quickly the brain understands, because the brain is not stupid. When it learns to do something which is better for it, it will do it. So and you just need to show the way. That's what we do with neurofeedback. We show the way. It's kind of, we show the way toward auto-regulation.
I think it's very powerful because you can clearly see actually how the brain operates. So for example, with other clinical tests, you can see the other parameters, and it's very powerful already. But with the brain, we don't really understand how it's working. So when you can see actual certain biomarkers, you can measure and change. I think it gives you so much power, as I said. Mm-hmm. But, guys, who have questions? Please, let's talk to Laurie. You can unmute and ask.
Yeah, sorry. So I have a quick question, actually. So you mentioned about neuroprofiling report based on the sensors and all the kinds of the receiver and the software you are creating and report. I just think like it is taking some snapshots from the brain activities and body condition, and this snapshot is giving you a kind of guideline or direction where is the area that you are supposed to work on it. Is that correct?
It's totally correct.
Since it is taking the snapshot, how different it's changed from one period of time to another? Is it a good guidance to give us a direction?
That's a
Is there
very
any
good
certain?
question. So I've been doing a lot of those profilings now, and there are some of the tendencies of someone would remain. But of course, if someone has less sleep the night before it comes, or any medication, this will affect the brain waves and the results, of course. But then the general tendency of someone, we keep that. We keep that from one time to the other. Is that answering your question?
Yes, I mean, I would like to understand if you make sufficient modeling for one single person during different period of time to see and verify that if these profiles are matching each other, or a small deviation is still acceptable level.
Yeah,
or...
there's still small deviation, of course. Like as I was saying, like the quality of your sleep the couple nights before, or if you're in a stress period, or this is mentioned. So I put some notes into the report that the people are receiving. So actually it's a double that they receive. And there's a note mentioning that, of course, what coffee will act as well on the brain waves, as I was saying, medication, sleep. But what I was saying is that the biggest tendency of someone will remain. Like if someone, I mean, there's, if someone is stressed because he doesn't make alpha wave because of an emotional trauma, or it's going to be hard to change. It's not like it's going to come back after he did a good meditation session. Maybe the numbers will move, but those scores that I depicted into this graph, this spider graph that you see, they are based on ranges. It's not like just numbers. It's really ranges of numbers. So there's huge variation. But we're taking this into account into those representations.
So when you are taking this measurement, are you preferring a certain period of time? Are you like just waking up or during the day?
No, not really. The only thing is that I'm doing those evaluation every 10 sessions. So I'm trying to have the people come at about the same time. So usually patient, I see them on more or less the same time.
This is irritating. Maybe you're dancing, but you're making lots of noise.
Oля.
Oh, I am sorry. I'm
not dancing.
Who's dancing?
Sorry, I'm unmuted myself and wasn't aware. And my daughter jumping, making noise, and I
No worries.
Sorry.
That's okay. Yeah,
I was not dancing, huh? So yeah, Denise, to answer your question, I'm trying at least the session, like the evaluation session, sorry, to make them at about the same time. But of course, it would be a challenge to do that. So children, I mostly see them on Wednesdays, and so when I do evaluation, it would be more or less at the same time. But I'm doing as best as I can with everyone's agenda and my mind. But of course, we need to have some standardized way to do it. But it's not a diagnostic tool. Just that's something I want to precise, and that it's precise in all my reports as well. I'm not putting any diagnostics with this. I'm just giving, exactly as you mentioned, a snapshot of the brain, and which can support some of the symptoms that the patient is coming with, and especially giving us some direction to work. Like on the graph you see on the screen, this person that will work, especially the sensory motor and the perceptive functions, more than training against, to fight against anxiety.
And I think what is more important to see the results and that correlation of improvement of symptoms and what actually you can monitor.
Yes.
I remember you were telling me about the girl who you measured the same progress. She was on Ritalin, and without Ritalin you could do it with the neurofeedback training. So for me, that's what, very, very important. You can achieve with this technique similar effect as we can do with the drugs.
Yeah. Something that is quite important to know as well is that once again, this is not a diagnostic tool, but let's say if we have a children like the profile you see now who has like attention deficit but no hyper anxiety, these children would support the Ritalin, which is, so you know that Ritalin is a psychostimulant. But if you take the same profile of a children and it's green because the scores in anxiety are low, these children will have a bad reaction to psychostimulant. See what I mean? So I'm not taking any decision on the drug because this is not my job, but I'm collaborating also with pediatrician and psychiatrists to sometimes show them that maybe for children who doesn't support Ritalin or Concerta, there would be one explanation, is that the children is already having high level of anxiety and won't support the psychostimulant.
And I think this is also this is where you can give a feedback to parents. It's up to them to feed this information to their medical doctor. At least they can maybe together make a solution.
Exactly.
So change medication or or something else. There is always plan B.
Yeah.
I would like to ask a question.
Sure.
Please. For example, if some child comes to you, or some parent comes to you with child with ADHD or autism, and you're going through the first assessment stage, how many sessions would you recommend to go through to see actual results, to start to see results, and to, let's say, what is maybe your standard package for maybe 5 or 10 or 15 sessions? What would you recommend?
Sure, that's of course the most frequent and the most tricky question, because this will all depend on the brain, on the permissivity. Can you say that? If the brain is permissive to the treatment, to the training?
Responsive brain to...
And also, as I was showing you, I'm using different modalities. So I will give the children and the parents some exercise at home to do and to practice with relaxations, and that's why the book is coming from, because the book is going to be a tool that the parents can also follow at home. It's going to be some guidelines through inside the book, right? So depending on how the children and the parents are going to be in the treatment, the results are going to be different. But I usually start to have some people reporting changes after 5 or 6 sessions already. It would be maybe a children is more focused, or is less agitated, less, how do you say, dissipé, less agitated in school, for instance, or is having less quick emotional reaction. That would be about, most often that I hear report from patient would be like around 5-6 sessions, but I usually do the first evaluation after 10 sessions. And of course, we're talking here about the training, like you would go to the gym and train your muscles. So the more the better, because you want to break some old automatism and make some new automatism. So that in any case, it's not a standalone therapy. It has to go together with changing lifestyle, changing bad habits, and stopping, like for older children, stopping the phone before going to sleep, all those kind of stuff that are impacting the attention and the sensory motor cortex that we are targeting here. So if I work hand in hand with the parents, with the children, then the progress are faster, of course.
Thank you very much for
sharing.
And
I think this is one of the techniques, and probably lots of techniques where the parents welcomed to watch. It's not just something you bring child and go for shopping.
No.
The Laurie really engage you as much as she can to explain, to show that you can learn, observe, and take that with you at home and practice with your child. Benefit for yourself, increase the value from these sessions as much as possible, so you can achieve the results as soon as possible. And I think that's where the great understanding of Laurie as a holistic professional is. So that's why I like her very much.
And maybe one point to bring it here in terms of number of sessions is that some of the complementary insurances in Switzerland are covering biofeedback. And I'm using biofeedback. That's why you see here with the little boy on the red chair, with my son, by the way. I'm very often combining biofeedback. So once again, biofeedback is everything but the brain waves. So I'm all the time combining both. So making some on one point is kind of strengthening the therapy, but it also makes that some of the insurance will cover the biofeedback part of it.
Okay.
So unfortunately not many, so it's something you need to ask before to your insurance. But I have the ASCA agreement, and the biofeedback therapies is covered by some of them.
Okay, that's very useful to know.
Yeah.
Okay.
Is it that covered by normal insurance or complementary insurance?
Complementary. This is part of the complementary and alternative medicine. So it's covered by those.
Okay. Any more questions, guys? You can unmute.
From the discussion, I understand the book is also pointing out or mentioning about this tool and method.
No, the book doesn't talk about neurofeedback. It's really it's a book about explaining chakras, so yoga chakras to children, but to their parents together. So there's an introduction about what really are chakras and how do they correspond in the more scientific word. And then each chakra is illustrated by a little tale, and then little exercises that the parents can do with the children. So I talk a lot about it's more a mindfulness book. I don't talk about neurofeedback at all. It's more oriented toward yoga.
But it's a part of training your brain and body to relax and be present, which is like a foundation step for neurofeedback.
Yes, but what I really wanted through this book is to have parents and children together. So it's not a children book, it's not an adult or parents book, it's a book for the family. And that's really my intention with that, is the same thing as I was telling you. I need to have the parents, playing in the same game as me, as the children, so we all together. So the book is kind of illustrating.
So for the both product, the techniques for chakras and this neurofeedback tool, do you have any YouTube or some videos that you are giving some insight that I can share?
We did one with Irina, actually. That's the only video I have so far. The book is really like a completely work in progress. So it's not, I just have a prototype at the moment, but it's on very quick progress. So by the summer, I hope it will be ready. Okay. So I will include that into my website with some pictures and where to find it, because I'm going to self edit and self-publish it. But then all those information will be linked to stars through Irina. And yeah, I have also my coalescence web page, as well as a Facebook page. So Facebook page, I'm going to update that very soon with all those informations.
Yeah, great. We're looking forward to it.
Sure. And I also have like flyers. So those flyers that I can send if you contact me. So it's English and French. I can send you a couple of flyers if you're interested as well.
Okay.
I think the beauty of this product or the tool is it is very difficult to find some real-time data that can show the reaction or diagnosis immediately, because every step of this process, it is taking ages, times, and this is just showing that what is available and very easy. So, and it is very tangible, measurable, something that give you kinds of direction. Of course, it can be discussed if there can be different ways to improve different areas. But at least it can be like a roadmap where are the areas that you can implement.
Yeah. I like to call that sometimes computer-assisted meditation, because you do the same work, but then sometimes, especially for children, meditation is quite another word, right? It's very difficult to just put the children into meditation, but then if you use those funny way to get into it, or here they have a movie, and then the brain does the same as what it does into meditation, which is to slow down. I mean, that's the biggest picture. Of course, the frontal brain, you don't want it to slow down, but through meditation, we act on the brain waves, and this is just faster than meditation because you get an immediate, instant feedback. So when you do meditation and you start to think about your shopping list, or no one is telling you that you're doing that, so you don't have feedback. So that's exactly the strength of neurofeedback and biofeedback.
How often, Laurie, you normally advise children to come? So once a week, twice a week? What is the optimal?
So usually it's once a week, because that's the easiest to have into their own program and into their life, like life of the parents as well. I don't want people to arrive in a rush because they don't have time or there are traffic. So once a week is ideal. And I am starting to develop also some little summer sessions. Like I've been working with some children that I could see only during holidays, and I see them four days a week. But here I do less neurofeedback, and I just mix more with mindfulness and give them some tools that I can use afterwards. But the fact, I feel that the fact of seeing them like almost every day on a week is creating stronger pattern, because they really realize how it helps them and they progress. But then usually I work with at the moment I work mostly with children once a week. And then I start to space out when we see that the results are here, and then like they kind of enforce me that they don't go back. I mean, it's not just one thing. They really improve. We start to space out the session, and then I mean I can see them like once a month, just as a kind of
maintain
exactly.
So it's like with any habits, with the building new neurological pathway.
This is the basis of neuroplasticity.
Nourish it and then just try to maintain it, make sure it's there.
Exactly. You're making new pathway and then you reinforce them, and you need time to do that. It's exactly the same thing that what you do at the gym, because at the end of the day, what you do at the gym is training your neuromuscular pathway. So if you go once, you will feel good, but then the muscle will kind of shrink after a week. If you go more regularly, then the muscle will be here. But in terms of brain pathway, since we are talking now about pattern that you are using every day, once you change, you don't go back.
Right. Because there it's established. So
exactly.
So did you notice any sort of a correlation between the results you achieve and sensory issues in children, improvement in sensory?
Been reports of
by parents maybe.
Some I mean, sensory would be more on the most striking that I've been as report from parents is the impulsivity. It seems that they manage more to step back from something that is triggering them, and that's something that I see also with adults a lot. You know, when there's this thing that is pushing your buttons and you can't handle that, people are reporting very quickly that they manage to make a distance with that, which is, for those who meditate, quite similar to the first benefits that you find from meditation. On the sensory, maybe more. It's mostly this. This.
No, but this is huge, isn't it? So it's part of the stress control.
Totally.
Okay, great. Any more questions, guys?
So in terms of the duration of this period, I mean, the diagnosis and discussion afterwards for the session, how long does it take?
For treatment, you mean?
Yes, for one days of period.
One session?
One session, including, I mean, the period that you are making the diagnosis and afterwards to discuss about the result.
So usually I see the children and the parents, because now we're talking about children. I see them the first time for 1 hour. So I take the time to do the diagnostic, then we have some questionnaire, then I show them the device for the breath, and they draw their breath so that I can see how they understand this and like it, because I use video games for that. And we discuss the results together already from the first session. And then I provide them with the reports, I mean, best 3-4 days after. It depends on the time that I have to make it, but usually I'm trying to have it quite fast. So right after they did the session, and then
Sorry, is it still requiring your intervention in terms of preparation of the report? You need to make
she needs to collect the data and make the
I'm making the, so there's a software on my computer that is calculating the data, and I made, so those graphs that you see, I made them myself. So I made some specific macros to have that. So yes, I need to analyze the results, not like you can. So we start to have more and more wearables now that are kind of cask that you can wear, and some are working. I mean, some are in development now. So I'm waiting for. I was part of a Kickstarter campaign. So I'm waiting for one of those tools, because hopefully, I mean, my idea is not to see patient every week, but to give them tools that they can work on it at home, and we can do another evaluation, because this kind of evaluation, I'm the only one to make them. So I see them regularly with those and see how they evolve, they develop, they progress. But ideally, yes, and I think it's science that is coming at the moment, is to have like those wearables that you can train at home. And that would be the best. And
maybe they will connect some apps and with
and I would prefer children, to watch TV if they have like something that is making them watch TV with the response of their brainwave, rather than just watching TV or video games. So but that's in progress. I mean, there's a lot of startup and companies developing those tools now. So I'm sure like in about less than 5 years, we would have those tools and can work at home. I'm using different devices that I also, so it's more now for adults, but I'm having a couple devices that help to train alpha brainwave that I can also lend to patients during sessions. And we have good results with that. So once again, I'm really trying to adapt each treatment to the person, and to give a different option that would fit the needs of this person. So that's why I'm coming with different tools, and then working a lot, like networking a lot with people like Irina, and doing great jobs. So we all come with the same idea, but different approaches. And I think especially I've been studying autism, development of autism and synapses in the autistic brains. And honestly, there's not one therapy that, I mean, it's so complex. There's one drug, no one therapy that would work. And and that's
why it's a beauty that we can, massage the brain and the body, stimulated from different angles.
And they work together. I mean, it's not, you cannot just treat the brain by one medication and ask the body to change. They work together. So that's what we're trying to do here. Is really, that's why I'm working with those balloons that you see here that the children sit it on, or some, this kind of kinetic sand, or those things, because the brain works with the body.
Yeah.
And that's also something that I'm now developing through craniosacral therapy. This is also work on progress, but there's very excellent results also in terms of helping children deal with stress and balance of the autonomic nervous system using cranial osteopathy.
My question is, when are you going to find the time to practice all you know?
I do, but
to get to your cabinet very soon.
No, the time. I mean, the time is a challenge for me, but then we always find it, because I'm just like I love what I do, and I love to share that, because this has helped me a lot, and I want to transmit that. So.
I've got a question. Do you know which neurotransmitters actually affected by neurofeedback?
There are some research on this. I mean, I would say most of serotonin, dopamine, and dopamine. I mean, my guess would be especially for dopamine, because you get this reward system going on, and then you get like, we're trying, so I'm having a big library of movies and cartoons, and then the children is happy to watch this cartoon, so it's happy when the cartoon works. So I would really like, if I would bet on one, it would be dopamine.
Dopamine probably is the best.
Yeah, but then once again, here we're talking more about the networks than neurotransmitter per se. So I think that neurotransmitter would be more resultant of the networks getting stronger.
Of course, it's not the prime sort of focus, but is a result of that. We can see but
that would be very interesting to go deeper into those research to see which one. But of course, it would be different. Like neurofeedback is a broad field, so some people would use different protocols. So I have a great protocol book that standardize a bit what is used, because like people do a little bit anything with it. So that's why I'm really happy to work with this machine and to start from an evaluation. It's not, we're not doing a shot in the dark and then do the same neurofeedback treatment to everyone, but we're really trying to think about what would fit the person.
Personalized approach is very, very important.
Yeah, and I think that's our future. I mean, that's the future of any medicine, like traditional medicine, like
any approach. I mean, in anything.
Yeah, totally.
Okay, great. Do we have more questions? Claire, are you there? Claire? I don't know, maybe not. Any more questions, guys? Olga? All clear?
Can I have one more question?
Yes, come on. I'm fine.
Sorry. So based on your database or the number of people or kids you tested, is it possible to just look at the one of the diagram and saying that this kid is different or deviated from normal situation?
In terms of the neuroprofiling, you mean?
Yes, exactly.
Yes, you would see based on the deviation, especially of the functioning of the sensory motor cortex. So that where you look especially for the attention and cognition, and here you would have an idea of if it's really far from the standard values or not. It would give you an idea of how strong is the condition, I would say. I mean, I'm saying that because I've been working with children, the same children with and without Ritalin. And then we saw differences, of course. Like we see that, of course, the Ritalin is making this better. But then, my pride with that was that after the children, we moved Ritalin, not on my advices, because once again, this is not my job or my decision to make. But the children stopped Ritalin and we keep on training him, and he was like getting to the same result after some sessions, of course, as what he was doing with Ritalin. And there have been actually some studies that show that treatment with Ritalin and treatment with neurofeedback were having the same results.
Compatible.
Exactly. We're not better, but then, I mean, neurofeedback is not better than Ritalin, but then it's giving you similar results with long sessions.
Without side effects.
Without the side effects, exactly.
Yeah.
So that's
a very linked question to this one. What is the minimum age you are?
That's an excellent question. I start with children. I mean, with neurofeedback, I start after 8.
8 years old.
Yeah, because before
not 8 months.
Not 8 months. You know what? Because until 8, the children is having a majority of theta brainwave, very slow brainwaves, and I wouldn't train them to do faster brainwave, because then you might impact the proper development of the brain. But I work with younger children, mostly with mindfulness and yoga-based approaches. Some of the exercise you will find is in the book is things that I'm doing like on a regular basis with children. I mean, younger than 8.
Okay, very good.
Good.
And for this, like, I'm really looking forward to offer the craniosacral treatment, because this you can go to like from 8 months and even earlier. And we have also excellent results here
and probably then younger than better, even because the skull is so soft and you have much better sort of freedom to manipulate and identify the little issues which can further already be much more difficult to correct, but can cause lots of problems.
The connection of the content of the brain, which is the skull and all the membranes around the brain, and the brain function themselves is like it's exactly the reason why we're saying I'm always a non-stopping student, because I want to study that. The connection is just so impressive, and then like having the tools is just making it great to test, and once again to offer different solution to
I think on this new solution, we're going to organize another micro class.
Yes.
I found it's absolutely.
And we will be faster on the Zoom this time.
Yeah, now we know how it works, and it looks very efficient once we connect and join on time and know which buttons to press.
Sure.
So, but I think now we ran out of time. It's 8, and if people missed some part of that or something, we're going to send the link for video. And I'm also going to distribute the Laurie's contact details if you want.
Yeah, I'm going to put it back.
Contact and organize the assessment and visit her in her.
Yeah, so you have here the website.
Yes, you can see it here in her office in Geneva. And you said you're going to move close to the station soon.
Yes, from July on, I will be at Gare Cornavin.
Yeah, so that would be much more convenient.
Yes, just in front of the train station, in front of the Starbucks of the train station.
Brilliant, very convenient place. But it doesn't mean the parents going to Starbucks.
No, they stay with us. They work with us.
All right. Okay, Laurie, thank you so much.
Sure, my pleasure. Thanks for having me.
Wisdom, for your experience, for your wish to help all of us and share your knowledge. So I'm sure it would wake up the lots of interest and follow-ups. So thanks again, and I'll see you soon.
Sure,
yeah,
thanks
thank
for
you very much. Have a good
thank
evening.
you, Rina and Olga, for all what you do.
Thank you. Thanks a lot.
Have a good evening, everyone. Bye.
Bye.